One type of cancer is multiple myeloma, also referred to as plasma cell neoplasms. This occurs when abnormal plasma cells develop into tumors located within the bone, including bone marrow and other soft tissues. When only one tumor develops, it is called plasmacytoma, and if many tumors develop, it is called multiple myeloma. It is important to note that plasma cells are in charge of fighting infection and making antibodies that attack germ cells. Multiple myeloma is developed in the bone marrow. The cancer develops osteolytic lesions, which make the bones more vulnerable to damage, like osteoporosis. The most common regions to get it include the ribs, hips, shoulders, spine, pelvic bones. Risk factors. Males are more likely to develop the multiple myeloma than females. This cancer is contracted mostly by people who are 50 years of age and older. This cancer is one that tends to be hereditary, so if a family member has had it, you definitely have an increased chance of developing multiple myeloma. Common signs and symptoms usually include bone pain, which occurs usually at the hips and the lower back, and osteoporosis, in which your bones break easily and are weak. There are shortages of leukocytes and erythrocytes, also known as white blood cells and red blood cells, as well as blood platelets, which develop into conditions such as anemia, leukopenia, thrombocytopenia. The blood may thicken from myeloma protein, causing hyperviscosity, in which less blood is delivered to the brain. Calcium levels are too high in the blood as well, which cause extreme thirst, extreme urination, dehydration, kidney problems, and even kidney failure, as well as severe constipation, abdominal pain, loss of appetite, and fatigue. The spinal cord compression may also include, which might lead to permanent paralysis, nerve damage due to toxicity of the myeloma protein, and patients are also more susceptible to infection. Multiple myeloma can usually be detected through complete blood count test, a blood chemistry test, a urine test, a quantitative immunoglobulins test, a bone marrow biopsy, and a bone X-ray. According to the American Cancer Society, in order to be diagnosed with multiple myeloma, a plasma cell tumor must be proven apparent by a biopsy and at least one of the following: a high blood calcium level, poor kidney function, low red blood cell counts, holes in the bones from tumors found by imaging studies such as CT, MRI, and PET scans, as well as 60% or more plasma cells in the bone marrow. Staging. According to the American Cancer Society, multiple myeloma is staged using the Revised International Staging System, RISS, and this is based on the amount of albumin in the blood, the amount of beta-2 microglobulin in the blood, the amount of LDH in the blood, and the specific gene abnormalities of the cancer. So, as you can see, these are the different stages, and the survival rates are measured through SEER and go on a basis of a 5-year survival rate. This means that there is no concrete measurements by stages. So for a localized cancer, such as a plasmacytoma, there's a 74% of a 5-year survival rate, whereas in multiple myeloma, there's a 51% survival rate. And this cancer combined has a survival rate of 52 to 53% survival rate. Treatment. Common treatments include local treatments such as radiation therapy or surgery to remove tumors. These treatments are used when the cancer is not so advanced or when the affected region is lesser in numbers. Side effects of radiation therapy include changes in skin such as redness, peeling skin and blisters, fatigue, nausea, diarrhea, and low blood counts. Chemotherapy is an oral treatment in which drug attempts to control or kill the cancer cells. These side effects include hair loss, mouth sores, loss of appetite, and nausea and vomiting. Stem cell transplants are also an available treatment but used only in cases where the cancer is active. The most common treatments include drugs such as a mixture of bortezomib, lenalidomide, and dexamethasone. Supportive treatments also include blood transfusions, antibiotics, and sometimes intravenous immunoglobulin for infections. The specialists that treat multiple myeloma include an orthopedic surgeon, radiation oncologist, a medical oncologist, and a bone marrow transplant specialist. Some statistics. The estimated cases for 2020 is 32,270 people, which is only 1.8% of all new cancer cases, and an estimated deaths of 12,830. So the people who actually get this tend to be 50 years and older, and only 1% of people are 35 and under.